That's 310-217-7731. Ask about our specials and month-end alkaline class. Breath of fresh air in your body. When you know better, you do better. You did.
Find your greatness.
The Front Page.
Radio Free.
102.3.
KJLH.
Times are wasting, endless doing so much hate, and free your heart and show your greatness. I, like you, had to come from up under the basement, just like you had Satan trying my patience.
It's Radio Free 102.3 KJLH. This is a special edition of the Front Page, how to deal with the coronavirus. 520-KJLH. We're taking your phone calls. We've got a variety of different guests being joined right now by Dr. Maita Kuvengua. I think I said it wrong. Kuvengua. It sounds so much cooler when you say it. She's a medical doctor and infectious diseases specialist from Martin Luther King Hospital. Thanks so much for joining us this morning, doctor.
Thank you.
And we are in studio with Dr. Glorious Morrow. She's a psychologist. Dr. Herb Wesson, council member Herb
Yes,
Wesson.
Dr. Wesson.
Has been with
and I'm
us.
here with Dr. Kuvengua.
And I know you have to go, but I thank you for joining us this morning. We're going all the way till 10 o'clock. We're taking your phone calls, but appreciate you. And I know you have to leave us, but just on the way out the door, what would you leave us with? I know your package of bills that we're hoping to pass, or measures, whatever you call them, from the city council on Tuesday to protect the people and give people backup resources.
Well, I think I just want to quickly go over it again. We want to try to put in place moratoriums on rental evictions, mortgage foreclosures, ensure that your power is not turned off, come up with an assistance program to help small business, mom and pop businesses and employees who've had their hours reduced or have actually lost their jobs. This is the time when government steps up, when all of us step up. We have to remember that we are the United States of America, not the divided states of America. This is not the time to, point a finger and blame people. This is a time for action. This is a call to action. And I'm just so excited to live where I live and to walk amongst the people I walk amongst, because I am very, very confident that we will get through this. It's going to be adjustments. People should be flexible. Things are going to be changing on a daily basis. I know hours in City Hall have been reduced. We're trying to, keep people safe by not having a lot of people. So just kind of, stay on your phone, see what's happening, listen to programs like this, and we'll find a way. We will all make a way. So thank you for having me, and I'll come back whenever you need.
We appreciate that. I know you got to go. I'm trying to get Emmett here to take a picture of you guys before you leave. We're also streaming live on Facebook. It's a Radio Free KJLH. You can find this program in video as well as audio. Herb Wesson, thank you so much for being with us. And thank you, Kimani. All right, 520-KJLH. We have a lot of calls. And I think, and I'm really glad you're here, because we have a lot of people that probably have questions about the actual disease part. So before we get back to the phones, can you give us just sort of a beginner's version of what is coronavirus COVID-19 and how do you catch it?
Okay, so COVID-19 is actually the disease that is caused by this new novel coronavirus. And what novel means is that it hadn't been described before, so we're still learning about it. It was first seen in December of 2019. There's actually a lot of different coronaviruses that commonly affect humans and cause the common cold, but this is not the same thing. The disease that this causes is a respiratory illness. The most common symptoms are fever, cough, shortness of breath, and the illnesses can range from a very mild illness similar to the common cold up to people who get quite ill. And it looks like the people who are getting the most ill are the ones who are either of advanced age or who have a chronic medical conditions. The way that it's spread, so we're still learning about that, but the most important way appears to be respiratory droplets. And so that's why We emphasize covering your cough. And if you're going to cough, cough into your elbow, not your hand. Wash your hands frequently. Respiratory viruses like influenza and this coronavirus spread through tiny respiratory droplets that can fly about 6 feet. And so that's one major way. And then other bodily fluids we're still learning about. And that's the other reason why we're emphasizing hand washing.
So that there is a difference between something being airborne and little droplets flying on, right? So people think it's airborne, meaning it's flying through the air and tiny, microscopic particles everywhere. That's not the same. That's not really what's happening, right?
Correct. Yeah, it's a limited radius of spread. And what the CDC has found so far is that 6 feet looks to be about the distance that they can travel.
That's why they want you to socially distance. In other words, if you are going to be out, trying to stay around 6 feet apart from people. Mm-hmm. So if their droplets do go flying, they're not going to fly onto you.
Correct.
And that's why we worry about surfaces, right? Because those droplets land on surfaces and they can stay there for quite a while, right?
Correct. Yeah. Some of the estimates that I've seen on CDC website and different articles in the literature are that it can be up to 3 days that these particles can survive on surfaces. So that's why we emphasize wiping things down with disinfectants and, again, washing your hands. Because if you touch a surface and then touch your mouth or your eyes, any mucous membrane, then you can get infected.
And so there's a right way to wash your hands too, right? I mean,
yes. So the CDC says that you should be washing for at least 20 seconds with your hands under running water. So one method is to sing happy birthday twice at the normal speed. Another one is to sing the alphabet song.
And just really scrub. You know what? This seems, I don't know. I'm a germaphobe anyway, right? I'm one of those people that deodorizes and cleans everything. My poor kid, I make him change when he comes home after riding the metro or whatever. You can't sit on my bed until you change. I'm one of those mamas. But fingernails. Mm-hmm. That's a lot of us like to have these long, luxurious fingernails. And that's where a lot of germs hide, isn't it?
You bring up an excellent point. So acrylic nails, anything that's kind of raised up off of your own nail is a great place to harbor bacteria. So that's why at hospitals, people who are involved with direct patient care actually can't have acrylic nails. And if you do have them in your regular life, you're not a healthcare worker, you really have to scrub. And people oftentimes forget when they're washing to clean under the nails. So you bring up a great point.
And one question that I've been asked again and again is, can you get it again? Like if you have coronavirus, can you get coronavirus a second time?
So we're still learning about that. We know from influenza that there are two strains, A and B, and I have seen patients who didn't get their flu shot. They get influenza A and then they get influenza B. So we're still learning about the different strains of the coronavirus. I believe that there's 3 at the moment, but that remains to be seen.
And that's one of the reasons why I think people don't understand why scientists are freaking out the way they are. Not just scientists, but politicians and communities, is because we don't know everything about it yet, right? So we don't know everything about how it spreads. We don't know everything about, what could happen, and that's why we're trying to limit it, right?
Mm-hmm. Yeah, that's exactly correct. We're trying our best to sort of decrease the spread as much as we can and prevent people from getting infected. We learned a lot of lessons from influenza about how to contain respiratory viruses. And so we're just emphasizing everything that we know, and research is ongoing.
Okay. We do have calls. And let's see. Let's go to VJack calling us from Orange County. Good morning, VJack.
Good morning. I'm Dominique, front page family, a distinguished panel. Being a postal worker, it's regardless what comes our way, we just like that band on the Titanic when it was going down, we got to keep playing. And I got to really, can you guess dispel the myth about black folks not being, this stupid thing going around on the internet about black folks not being able to contract this virus. It's very scary, and it's stressful enough going in Costco, people flipping out because I'm not worried about toilet paper. I ain't never seen nobody perish without toilet paper. But we need water and stuff like that.
Yeah.
And I just think that's just the tip of the iceberg.
Okay, so do you have a question?
Yeah, I just want to know, I know we're still learning about the virus, but can you contact it from like a doorknob handle or something like that?
Got it. Thank you, Vijay. Appreciate that. Yeah, so you were just talking about surfaces. What about doorknobs?
Yeah.
Et cetera.
So those are what we call fomites, these surfaces where viruses and other sorts of infections can live. So yes, it is possible. And that's why we emphasize hand washing, because you never know who's touched a door handle before you. And so if you protect yourself by washing your hands or using an alcohol-based hand rub like Purell or any brand really, then you're protecting yourself. And the other thing is not touching your eyes, mouth, nose with unwashed hands.
Well, I mean, and people are panicking because they're running out of hand sanitizer, but you know what? You can use soap and water, right? That's just as effective.
Yep, that's correct.
Okay, I just want us to get back grounded in common sense. And VJack also referenced this idea on the internet that Black people can't get coronavirus. Have they seen the Utah Jazz? I'm asking for a friend.
So I have not heard any reports from credible sources of there being like differences in race or ethnicity in terms of contracting this virus. It's spread worldwide. So, I think it can affect anybody, and we all need to just be prepared and try to protect ourselves.
Maybe because it hasn't been as widespread in Africa. I don't know. But, that doesn't mean it couldn't be. Joined by another guest, a friend of this radio station. She's a medical doctor, board-certified family medicine physician. And she did UCLA Medical Center, Pritzker School of Medicine. Dr. Noelle Reed, good morning.
Good morning.
Thanks for coming in.
No problem.
Okay, we got the doctors are in. We got an infectious disease specialist,
right.
elbow bump, a family practitioner, and we have a psychologist, Dr. Gloria Morrow. So we are doctored up. And you got questions, 520-KJLH. And I love seeing these three beautiful Black women with so much knowledge that you guys are able to share, and so generous with your time to share with our community in a time of crisis, in a time where there's a lot of rumors and misinformation flying. If you get something on your phone, a text, a WhatsApp, or whatever, some inbox on your Facebook, don't just believe that.
Absolutely.
You wouldn't believe some guy on the street who came up to you and said this, I'm going to sell you this shirt for $900. Like, you would use your common sense. So why don't we use our common sense on the internet? Dr. Gloria Morrow, why don't we use our common sense on the internet?
Because we're afraid and we're looking for answers. And I think anything that we receive, we believe it's true. Because, we do that anyway. It could be about anything. So I just want to tell people to be grounded and make sure that your sources are credible.
Yeah.
Make sure you're getting it from the CDC or from some governmental agency so that we can kind of pay attention to what we need to pay attention to.
Yeah. Dr. Noelle, go ahead.
I was going to say, and that's very important, because I think that fear can be just as contagious as the virus itself.
Yes.
And I think that that's spread at a more rapid rate at this point now, because people are kind of scrambling, trying to find information anywhere just to have more understanding. And that is what I think has been the most frustrating thing, as a clinician during this time, is really having to ease the fears and explain information that's been given that perhaps was not correct. Right. And understand, too, that we're really living in a new normal right now, where we kind of have to stay engaged, because this is an evolving process. So as we're learning things change. As a clinician, I'm checking in every day to see what the protocols and guidelines are that were different from yesterday. And so that means that as a community, we have to check in, but in a healthy way, so that it is an engagement, but not an obsession. And I think that it's kind of like finding that balance, between the two.
Talk to me about the protocol, as you just mentioned. If I'm feeling sick, maybe I think I have coronavirus, or maybe I have something else going on. I think medical protocols are not the same right now. You're not necessarily encouraged to rush to the emergency room, right, if you think you have COVID-19.
Right. So phone first. That is what is typically the best option, especially if you're symptomatic. So if you have a fever or what have you, is to call your doctor first to discuss and see what are the next best steps. So, having that triage over the phone is a better option. You do not just want to show up in anybody's office, doctor's office or urgent care or what have you.
Because you can infect all kinds of people, right?
Oh,
by
potentially.
Doing that.
And be infected.
Or be exposed.
Yeah.
So in order to have better control, it's better to call first just to see, do I meet criteria? And the criteria are different depending upon what health organization or health policies you're following. So, the LA County Department of Public Health's guidelines differ a bit slightly from CDC. So there are essentially two different pathways that we follow as a clinician in terms of how we test that individual and do they meet criteria. As it stands now, the LA County Department of Public Health has stricter guidelines for screening those for COVID-19. The reason being is that they're looking for the highest risk individuals. So they need to be tapped in right away. There is a limited capacity in terms of testing. So we have to be more cautious in terms of what sampling we're sending to those types of labs. So if they don't meet criteria, then perhaps you can use a commercial lab. So just as of this past week, actually, commercial labs such as Quest and LabCorp have now been able to accept sampling for COVID-19. So in that case, you can follow the CDC guidelines, which are not as strict, which typically means that at the physician's discretion, not at the patient's request. Right. And let's make that point. You know, just because you ask for a test does not mean that you're going to get it.
So it sounds like you guys are getting rushed with people saying, test me, test me.
Yeah. Yes.
Test me. I want to be quarantined. I want to be on the news.
Put me on a 14-day quarantine.
Lord,
well,
help us. Okay, so let's go to Raylene calling us from Long Beach. Good morning, Raylene.
Good morning.
What's your question?
Okay, I have a balcony, a small balcony. I live in an apartment building, and I have a garden. And I've been growing it for a couple of years, and it's covered up, but not all the way. And it's only covered up from the elements, the rain and all that. I'm wondering, is that food safe to eat?
Okay, why wouldn't it be? I mean, you're going to wash your vegetables, right? Why are you worried about it? You think someone's sneaking up there and sneezing on it? I'm not sure.
Well, I don't know. That's why I'm asking.
Okay.
I have a lot of underlying medical issues.
Okay, so
I'm
you're
just
being
asking,
extra careful. Yeah, so what
Yes,
would you guys, what would the panel say? That was me. I'm not an expert. What do you guys say?
Okay.
I didn't hear the
She's saying that she has a small garden that she's growing, covered up from the rain, but not totally. And she's worried that it might not be safe to eat her vegetables.
So there isn't a risk. What we know is that these respiratory viruses are spread through droplets, and those travel about 6 feet. So, if it's on your balcony, it's your own personal garden. There's not going to be a risk there for contracting coronavirus.
All right. Thank you so much.
Yeah.
And the other thing, someone brought this up on Front Page last week, is lots of catering companies do this, soak your fruits and vegetables in a solution of water and a tiny bit of bleach, and then rinse them out and leave them, soak them. A lot of restaurants do that. And then you rinse it out with fresh water. And if you're having a lot of underlying issues, or you're like me and you're just a germaphobe, you might want to do that just to assure yourself, right, Dr. Moroso? Because feeling better about what you're eating.
All right. Thank you so much.
And if you're a little OCD, it's going to be a little bit more increased right now. So we're hopeful that you will. And that was a very good question, by the way. Thank you for asking it.
Yeah.
All right.
Applies
Thank
to
you
a lot
so much.
of things. Yeah, thank you. I mean, it applies to if I bought something from the farmer's market, if I got it from the 99-cent store, and it was looking a little funky. Yeah. All right, let's go to Mike from LA. Good morning, Mike.
Hey, good morning, Tommy. Thank you for taking my call. I want to know with the crowd limit, how is that going to be enforced? Because you can't. I don't know if you can do it at a market.
Okay, so here's the thing. The state of California, this is where all my reading till I can't sleep anymore is going to help you guys out. The state of California has limited crowds to 250. The city of LA says 50, but they are suggestions. So I think what's happening right now is our government officials are being very careful because they know people are freaked out. Oh, it's going to be martial law. We're going to miss that, blah, blah, blah. You know how we are. We go off to deep end with conspiracy. They're not going to enforce it, Mike. If you really feel like you want to have a rave, you can do it. It's just not a good idea because you're going to be closer than 6 feet to people, and you're going to get their little droplets. And they suggested if you do want to go into a large crowd, you try to stay 6 feet away from the people. Same with the market, right? Go when it's not so busy. Go right when it's open. Yeah. They might actually have some stuff on their shelves. They're asking you to self-regulate.
Oh, okay.
Does that make sense?
Yes.
Yeah.
All right.
The National Guard is not coming to shut down your birthday party. That's not happening.
I'm so glad to hear that. I have one coming.
Yeah, exactly. Let's go to Mimi from LA. Hi, Mimi. Mimi, you with us? Have we lost Mimi? Did Mimi go out to breakfast?
Hi, who is this?
There you are. You're on the radio right now, Mimi. Who you think it is?
This is not me.
Oh, you jumped the line. Who is it actually?
Okay, this is Sheila from Los Angeles. Good morning.
Sheila, good morning.
Good
What
morning.
did you want to talk
Okay.
about, Sheila?
Okay, you guys have spoke about on different ways to come in contact with the virus, and I was thinking, had anyone mentioned about like money, passing money?
Yeah, can you get it from money? Yeah, a lot of people have been talking about that. Yeah, so
because a lot of germs hide, and then people who also smoke marijuana. They
passing joints and passing down. I am not laughing at you. I'm laughing at me.
Okay.
So this sounds like it's a question for you.
Oh yeah. So
For me?
hold on. Listen, Dr. Kavengwa.
So any sort of sharing of respiratory secretions like kissing, if that's sharing a joint, does pose a risk of, possibly contracting this virus. You bring up a really great point with the money, though, because money is not clean. There's a lot of other stuff on money as well, like fecal matter and very undesirable things. So washing your hands or using those alcohol-based hand rubs after you touch money is a great idea.
Yeah.
Or swipe if you can. Just use your card.
But we should do that anyway.
Yeah. And as far as we know, there's no clear timeline that we know for COVID-19 that it stays viable on substances. We don't necessarily have the data as yet for that. The thought is that perhaps it remains on surfaces for about 2 hours, perhaps. Yeah. There was a study that was done on SARS, so another coronavirus within the same family of COVID-19, where they looked at the viability of viruses on different types of surfaces, and it showed that they could last anywhere from less than 5 minutes to as long as 9 days. Yeah. So that's a very vast timeline, but I think it depends on many things. So it depends on the type of surface, the environment around it, and also the viability of the virus to actually be able to infect. But I think that a good rule of thumb is that whenever you are in contact with something such as money, which we know is dirty, that you always wash your hands, after handling, and always disinfect high-use surfaces, so, in your home or workplace, that countertops, doorknobs, light switches, TV remotes, those things that come into contact with humans on a regular basis.
Right?
Our phones, probably one of the dirtiest things, right? That perhaps you don't have your phone in your bed.
People take it to the bathroom.
Yeah.
They have it under their armpit, sneeze into your elbow, and then you're holding your phone against your body with that. I saw, and I've read articles, saying anything from, like you said, 2 hours to all the way like 9-10 days that it can stay. So, but washing, what can hurt? My hands are a bit dry because I've been washing them so much. That's what lotion is for.
You see, it's a lot of people that can't wash their hands often. As regular people,
like homeless people, yeah. And I'm glad you said that. I wanted to point out the city of LA is putting in 100 hand washing stations. It's supposed to be going up in the next week, mostly for people who are homeless or people who don't have the ability to just, run and wash their hands. So that's one thing that's being done. We know we can make our own hand sanitizer. If you can find some aloe vera gel and alcohol, you can make your own if you can't find it. And so, great questions, Sheila. I'm glad you snuck in.
Have a good day.
All right, you too.
Bye-bye.
Let's go to Wilma calling us from Inglewood. Hi, Wilma.
Yeah, hello?
Yes, you're on the radio.
Oh, okay. Yeah, like I was saying, there's so many different things going around that rumors.
Yes.
Some people say once you get the symptoms, it's already too late. Even the president of the United States said yesterday, they asked him, are you going to get tested? He said, well, I probably will, but I don't have any symptoms. So you just don't know.
Okay, first of all, Wilma, on what other things do you take the president of the United States advice? That's just a reality check for you. I'm just asking. Like, really? Is that who you turn to for counsel? Just asking.
Can I add one thing right quick?
Yes, ma'am.
I'm over here on Century at Costco, and the line to get in is a mile long. There's panic. There's complete panic.
Okay, here's my unprofessional response to that. Take yourself home. Have you a nice bath, a glass of wine, or whatever it is you do. Pray to the Lord, whatever you do, and wait for them fools to go away.
Right.
Because Costco got warehouses. I've talked to a guy that works at Costco, and he says what happens, all the shelves empty out, everyone freaks out, oh, it's over. And then everyone goes away and they restock the shelves. And then another wave of people come and they buy everything. The people, there's no more toilet paper. No, there's no more toilet paper today.
Right.
The people can only stock the shelves so fast. It's Costco, for goodness sake. They want to sell you 5,000 rolls of toilet paper. How many do you think they got? Come on,
Absolutely.
people. Let's stop it. Let's stop it.
And stop focusing on the news all day long. I think what's happened, it's just like 9/11, you know, when that plane kept hitting the building, we keep getting re-traumatized. So I think if we can just stop watching and listening to the news all the time, we will go home, relax, do practice mindfulness, taking some deep breaths, and enjoying this season, because you know you can't do anything about it other than stay safe and use common sense strategies to keep you and your family
My
safe.
common sense strategy is watch Netflix.
Absolutely.
But you know, she Wilma did bring up one interesting point, which is, you know, this idea about symptoms and like it's too late. Like, what does it's too late mean? Dr. Kuvengwa, like, for example, if I'm sick, doesn't mean, oh, I'm automatically going to die or I'm automatically going to get sicker or even that I automatically have COVID-19, right?
Yeah, it basically the symptoms of this virus mimic a lot of other respiratory viruses, and so the phrase "it's already too late" doesn't really make sense to me. All the not saying that your question doesn't make sense, but I think that the sort of the hysteria that's been played up by the media about being too late to save you or something like that. Basically, it's about your symptoms and how you're feeling and when you should seek medical care. You know, if you're feeling unwell and you feel like you can't take care of yourself at home, or you're having trouble breathing, or you can't eat, then, you know, by all means, seek medical care for concerning symptoms. But if it's a mild illness where it's a, you know, common cold kind of thing and you're getting better, then you can stay at home, call your doctor's office for medical advice. I think that I just don't want people to be scared and thinking that if they get cold symptoms that they're going to die. That is not the case here.
And you're listening to a medical doctor right now from Martin Luther King Jr. Hospital. You're also, you know, Dr. Kuvengwa. We have Dr. Noel Reed, who is a MD medical doctor and family practitioner. You're listening to Dr. Gloria Morrow, who is a psychologist. These are folks, not people that have a YouTube channel that just thought up something to tell you, right? These are people that have gone to school and studied. They're also trusted Black women that we know that work and live in our community. You know what I'm saying? These are not some carpetbaggers trying to make $1 out of, hey, I got a cure for coronavirus, $5,000. Like, we need to get back to, I really feel like we got to get back to, you know, what we know.
Yes.
We're Black people.
Right.
We
Thank
have, you know, we're going to be all right.
We are.
Thank you,
Yes.
Wilma. You asked a question that a lot of people probably were too chicken to ask.
Right.
Always love that. Let's go to Sultan Muhammad, who's been waiting. Thank you for your patience, Sultan Muhammad.
Good morning, Miss Dominic Dupree. Are you guys able to hear me?
Yes.
Yes.
Okay, my name is Sultan Muhammad. I happen to be the only African-American-owned ambulance company out of the city of Compton. I just want to bring some information to you guys as far as a lot of your providers, the smaller providers. We're having a big strain on supplies coming down to us.
Yeah.
And that's bad because our main supply line that we go to is backed up, and now the stores are our secondary supply line, in which we're not able to get the things that we need.
Sultan, when you hold on, just for clarification, supplies of what?
Such as the disinfectants, the
medical
hand
supplies.
sanitizers.
Yes, medical
yes. And I
supplies.
just
Got
want to
it.
bring awareness to that, and I wish Mr. Herb Wesson was still there, is that we need to get more help and resources from the county and the Los Angeles, which are
Well, they're well aware of that. I mean, I've been
they
in
have
touch with city and
stockpiles.
county. They're doing a lot. They're well aware of that. Those things,
Yeah, they
you know,
have
because
stockpiles of
we're
it, but we don't
talking
have
about
access
supply
to it.
chain. Yeah, we're well aware of that. And I think you might want to pay attention to what's happening since you have your own business on Tuesday with these, you know, with these measures that are being taken to help small businesses, to help individuals, not just with their own, you know, they're trying to stop all evictions and foreclosures right now, but help businesses stay afloat, and particularly medical businesses, because we're going to need your services. So
Yes,
I would
providers, yes.
Yeah, I would stay on top of that. I think small providers are going to be burdened, and I think you are also going to be very eligible for help because they're going to they, meaning city and county and state, are going to need you
For sure.
So I would look forward to getting help in that sense. And that is something we've seen. And I want to address this to our two MDs here about the masks.
Yes.
I have even friends that are like buying masks and stockpiling masks. And my understanding from my readathon is that the masks are good to protect other people from you, but they don't protect you from other people. I've even seen people putting masks on their dogs. Stop it.
I know. People always take it to the next level.
Yes.
But you are very correct. So the purpose of the mask is for those who are symptomatic. So if you have cough, sneeze, you have a fever, you wear the mask so that you are preventing your respiratory droplets from getting to others, right? And that if you are to wear a mask when you're asymptomatic, meaning that you do not have any symptoms, you could potentially be increasing your risk for infection. Because when you think about what happens, our natural behaviors, we touch things, right? So we touch surfaces, we touch our mask. And so those pathogens that we're trying to prevent, if they get on the mask and inside the mask, you're holding that directly against your nose and your mouth.
Oh, geez.
So that's not a helpful situation. Now, the CDC guidelines have broadened a bit just recently in terms of recommending for those who are going to be in direct or close contact with individuals who are sick, say caregivers, or you're living in the home with someone who's in isolation, that you wear a mask, yes, when you're around that individual, when you're not symptomatic. But outside of that, if you're not going to be a caregiver in close contact with someone who is ill, there's no need to wear a mask. So that's what we should know moving forward.
Well, the other thing about it is like, one of the things I learned in this is in the infectious disease line is that one of the reasons, because I'm always like, calm down, as you guys can see, but we can have coronavirus or COVID-19 and have no symptoms and be walking around and give it to other people without ever knowing we have it. We may never even get sick, right? If we're healthy, we have a strong immune system, we could get grandma sick, grandpa sick, or our friend who's sick, really sick. And so that's why you would wear a mask in the house if you're a caregiver, not because it's going to protect you again, but because you're protecting others, right?
Correct.
So, I mean, is what I just said true? Can you walk around having it, not knowing you're having it and giving it to other people?
It is possible to be an asymptomatic carrier, which is what you're describing.
Yeah.
Yeah. I mean, I think that's one of the reasons why we're talking about shutting down schools. Most of the kids, we're not talking about it, we're doing it. LAUSD, all campuses are closed starting Monday. Remember, folks, starting Wednesday, there will be 40 centers where you can get childcare or food for your kid during this time when they're shut down. No one's abandoning you. This is the front page. It's a special edition on Saturday. And we thank Guy Black and Roland Bynum for sharing their time with us today. We're taking your phone calls, 520-KJLH, 520-5554. Just add an area code of your choice. And we're doing this because we are you. And we got you, and all of us need this information so we can be. I heard one doctor say facts, not fear, and I just really like that.
Yes.
Because it's not that we want to pretend nothing's happening, right, Dr. Morrow?
Right. And fear means false evidence appearing real. And sometimes when people are fearful, we really don't have enough information to get ourselves all worked up. So we just have to make sure we are staying as calm as we can.
All right, we're going to go to Linda from Norwalk. Good morning, Linda.
Hi, Dominique. Thank you guys for the platform. My question to the doctor is, like going to the grocery store, should we be concerned like touching the keypad when you go to make your credit card purchases?
So the keypads, the credit card, I actually read about this for airport too, that they want you to call and check in on the phone if possible so as to avoid touching those pads. What would you say to her about her grocery store keypad?
So, yeah, I think it's appropriate to be concerned about touching surfaces because we don't for sure know how long this virus can survive on all the surfaces. And I think, carrying some hand sanitizer that you can use afterwards, because sometimes it's unavoidable. You have to use a keypad in order to make your purchase. But if you have something that you can use to clean your hands afterwards, then it definitely helps.
I read that when you use the sanitizer, you're supposed to rub until your hands are completely dry.
Correct.
So you just don't squirt it on and then keep it pushing. You actually have to rub it in until your hand is dry for it to work.
Yes.
You know what I do when I go to the gas station? Okay, and I've been doing this long before coronavirus because I'm a germaphobe. I admit it. I take one of my keys on my keychain and I use it to punch the buttons, like to punch in the button at the gas station. You still have to lift up the gas pump, I think if someone would start some full serve, they'd be probably making a bundle right now. Great question, though. Thank you, Linda. Appreciate you.
Thank you. Okay.
We're going to go to Nita from Los Angeles. Good morning, Nita.
Hi, good morning, you all. I'm Nita.
Morning.
I'm a sickle cell educator advocate, and I have to ask a question for our community. What are the people who are diagnosed with sickle cell who are going to be in a pain crisis? What are they supposed to do about going to the emergency room and the hospital? Please.
That's a great question because it applies to any, chronic condition that needs hospitalization.
Yeah. I don't think that it should be any different than any other time. If you're in crisis, you need to be seen. So I wouldn't say that at this point that should hinder you or you should not go to the emergency room if you need direct medical care. Now, if there's a possibility of perhaps you being seen by your primary care doctor, other than going to an urgent care or ER, perhaps, go that route if it's possible. But if it's situation where hospitalization is required or there's just a higher level of care that's needed, then go to the hospital. So
the call first, Dr. Reed, that you were talking about is for people who think they have coronavirus.
Yes.
You call first because you don't want to just show up and infect everybody in the whole hospital. And so that they have, this is what Dr. Relaford was talking about yesterday. They have protocols for how to receive you.
Exactly.
And so that
we
you
can prepare for you before you arrive.
Right. It's not for you, Nita. If you need to go to the hospital and you don't have coronavirus, you should still go?
Yes.
Yeah. Does that answer the question?
Yes, it does. Thank you so much.
Okay, God bless you. You answered a lot of people's questions. Nita, we're going to Teresa from Long Beach. Good morning, Teresa.
Good morning.
Welcome.
Good morning.
Jumbo.
Welcome. My question is, for the African focus trip, is that still going to happen? Like if we're making payments, should we continue to make payments? And for those who want to make payments that haven't started, should they make their payments?
So this is where we are with the African Focus trip. This is a trip that we're doing to South Africa and Zimbabwe with African Focus Incorporated. It's our 5th annual. Actually, we have a meeting today at 11 at Queens in Inglewood if you want to come and get more details and ask more questions and if you have concerns. It's today at 11. I'll be there. But we are still planning to go, but like every other trip, festival, occasion, we are monitoring the situation. Our trip is not till June. So that gives us plenty of time to see where we are. The contract that you signed has clear guidelines about cancellations and all that, and we're going to do our best to make sure everyone gets taken care of to the best of our ability. My plan is to go. In reality, right now, we're safer in Africa than we are in the United States. My girlfriend, especially if you look at the map of where COVID-19 is, Africa might be the safest place in the world at the moment. Still got to get through those airports and planes. I think if you had a chronic respiratory problem, that might be something to really look at. We're monitoring the situation. The schools are giving it 2 weeks to monitor and analyze and see how the spread is going and how the response is and what is sensible. We're not going to endanger anyone, but my plan is to go. I feel like I have a girlfriend who's a flight attendant. She says she's never seen planes any cleaner. She says not just because their cleaning crews are coming in with bleach, et cetera, but because the passengers are all coming on with antibacterial wipes and scrubbing everything every trip. And and we take Ethiopia Airlines, which tends to be wonderful and very clean anyway. So I'm planning to go.
Okay. And what's the address to Queens for today?
Oh, goodness. I should have that at my fingertips, but I don't. It's Centinela and La Brea. It's in that strip mall where the Starbucks is, upstairs, second floor. I will announce it before the end of the show. And also, it's on my Instagram. Radio Free KJLH or Deprima Radio.
Thank you, guys.
Great questions. Okay, we have Will calling from Huntington Beach. Good morning, Will. Will, are you ready? Hi.
Good morning.
Yeah.
Hi. I just want to ask the question is elderberry syrup is a good immune system fighter maintenance to drink every day? And I heard Lysol was real good as well.
Lysol? Not to drink. Oh, Lysol spray. Yeah, well, Lysol spray is on the CDC list of things that you can use, right? Bleach. What are do you know, Doctor, what are the other things on the list besides Lysol?
So I don't know offhand. There are some Clorox products that are also like multi-surface disinfectant products, and the labels, that I would encourage people to read the labels, because if you turn it around, it will say kills viruses. Sometimes they'll list things like influenza. That's what you'd want to be looking for. The other thing I want to say is be careful with bleach, because people are getting chemical burns by cleaning with straight bleach. But you have to dilute it.
Ooh, yeah, that's a great point. Yeah,
Yeah.
we were going to get to that. Don't worry, I didn't forget you.
I was going to say, you can also look for labeling for the EPA label. If it has EPA on the label in terms of disinfectant, then it should be at a level that it can kill viruses.
And you know what I was thinking about this morning? Yeah, you don't want to clean with straight bleach, but for all the people freaking out because you can't find bleach wipes, get some water and some bleach, get a rag. Ta-da, bleach wipe. Come on, people. Let's use our knowledge that we already have. Okay, so to the elderberry. That's one of the things that's going around the internet. I myself have used elderberry when I have a cough syrup, when I have a cough. Seems to calm the throat. Not a cure-all, I think you're going to say.
Probably not. So there's not a significant amount of data to suggest that elderberry or other vitamins or supplements, first of all, kill viruses, because I think that's what's being put on the internet, is they actually kill viruses, and so that's all that you need as a protectant. That is not true. I do think that it's helpful for us to, do those things that boost our immune system. So yes, take your vitamin C, take your multivitamin.
Vitamin D, they're saying now too, right?
Multivitamin, vitamin C for sure, and basic practices, I think, that are also helpful to boost the immune system. So getting your rest, making sure you're getting 7 to 8 hours a night consistently of sleep.
Oh boy.
Yes. Drinking water. This is something that I think we don't put a lot of emphasis on, but dehydration actually increases your risk of infection, because when your mucous membranes are drier, that's easy for viruses and pathogens to invade and infect. So drinking your water daily, for most adults, that's 2 to 3 liters a day. So much more than probably people think that they should be taking in or they are taking in. And making sure that, we're also keeping our stress levels low, right? Because when we're stressed and those cortisol levels are high, that also has an impact on the immune system. So these are just, basic behaviors that should be in place anyway, but not putting all faith on a supplement. It's okay to take. I don't think that it's harmful. I just don't think that that should be your end-all, be-all.
Got it, Will?
Yes, ma'am.
And I get that. I mean, I got mad at an article in the New York Times yesterday. I yell at the computer screen sometimes, because they said, well, there's no evidence that eating citrus fruits and herbs helps your immune system. That's not true. If citrus fruits have vitamin C, then it helps your immune system, right? Why are they so hell-bent on making us not do the natural things? I don't get that. But on the other hand, I think this tendency to say, oh, if I take elderberry, I can keep smoking crack and I'll be healthy. No, that's not how it works. You have to have a holistic kind of wellness approach, right?
Yes.
I mean,
Exactly.
Is that fair?
Yes,
absolutely. I mean, I know I'm more on the holistic side. You know that, Dr.
I
Reed, 'cause
know.
we have these conversations. I'm always like, well, I'm taking my echinacea. I don't care what y'all say. It can't hurt you. No. But I think to your point is a good one. That's not enough. You got to drink your water, get your sleep. And we got a bunch of calls, so I'm going to keep taking calls. But I want to ask Dr. Gloria Morrow. I think Dr. Gloria Morrow and Dr. Noelle Reed like a match made in heaven.
Yes.
Because she's a psychologist, she's an MD. And of course you, you too,
We're
Dr.
a great team today.
Because you talk a lot about mindfulness too. And Dr. Reed is the only MD I know that has a yoga studio attached to her medical office.
Yes.
Yoga, Pilates, And so, but these really interact. I mean, when we talk about mindfulness, meditation, you talked about rest and sleep. These are things that, it's not just airy-fairy. It actually impacts our ability to fight off a virus like COVID-19.
Absolutely. And we have to manage our stress. You're going to have a little stress. We're going to have a little anxiety.
Yeah.
But learn how to manage it and learn how to maintain positive emotions during tough times. And that's one of the skills that we really have. We're very, very resilient. And we can do that. But if you are talking to negative people, you're on the phone always talking to somebody who's afraid and all of that, that's going to bring you down.
Yes.
And make you more fearful. So make sure you're talking to healthy people. You ought to go through that cell phone and just start deleting some folks.
That is true.
I can't talk to you when I'm going through because you're going to pull me all the way down.
Energy is contagious.
It is.
Well, and I think it's good to have handy phrases like, oh, my child is calling me. I have to help him with his homework. Whatever it is you need to do to get off the phone. Because sometimes you can find yourself getting sucked into a conversation. Even yesterday when I was reading and preparing for this show, I started feeling a little overwhelmed. And I'm like, you know what? I'm going to go and have me some, something really delicious. Yeah. And I'm going to sit and watch some junk TV for about half an hour.
Absolutely.
I'm going to go watch something really stupid. And then I'm going to come back, I'm going to watch The Real Housewives of something or other. And then I'm going to come back and read some more about this virus. It's just like, I'm going to go see an old, whatever it is, whatever makes you happy. Game of Thrones or, whatever's going on that makes you happy. I think, and I did feel a lot better. Okay, I'm ready to read another 5,000 articles about COVID-19 now.
Yeah, Dr. Reed said it. She said, we have to develop a new normal right now. And so part of that can be, kind of reconstructing what we've been doing that's so destructive to our own health. And that is getting some rest and relaxation.
Yes.
And learning not to, focus on the past, because then we're going to be more depressed. And then if we focus on the future, we're going to be more anxious.
Right.
But if we can just be in the here and now, in the present, I'm here today. I have no symptoms today. I have no diagnosis today. So I'm going to really enjoy this day.
Yeah.
And I think people need to develop that.
Such a good point. You cannot worry about things that you cannot change.
Yes.
And so that's why it's important to bring yourself to the present. So doing things such as mindfulness, pranayama, breath work.
Explain what pranayama is.
Hello.
Just a moment. Hold on.
So pranayama is what we do in yoga practice. So that's intentional breathing, where we essentially are slowing down the respiratory rate. We're breathing from our diaphragm, not from our chest. So what that allows us to do is thus slow down the respiratory rate so that sends a direct signal to the central nervous system, to our brain, to switch gears, because we typically function in two modes, and that's sympathetic drive or parasympathetic drive. Sympathetic drive is fight or flight mode. So that's when epinephrine, adrenaline, cortisol is being pumped up. Those are the chemicals that make us feel anxious and fearful. Parasympathetic drive is where rest and digestion occurs. So that's where we're more calm. And so by simply slowing down the breath, that tells the brain that we're okay. We don't need to be in fight or flight. It communicates to the adrenals, our adrenal gland, to slow down the release of adrenaline and cortisol, and hence has a calming effect on the body. So I like to do what I call the power of 5, and I do this often with my patients in the office, where you essentially inhale for a count of 5, you hold your breath for a count of 5, you exhale for a count of 5. So what you're doing is slowing down, you're extending the respiratory cycle, so that you're breathing at essentially 4 breaths per minute, where most of us are perhaps breathing 12 to 16 breaths per minute. That's excitatory. So when you breathe slower, that is now allowing the brain to say, we're good. We can be at ease.
And they feel it. They feel it. They feel it in their body.
Oh, for sure. And it's immediate.
You feel relaxed. Your muscles feel relaxed.
The reason I was smiling is because Dr. Reed said that one time on my show, and now I do it in the car all the time. Every time I find my middle finger trying to pop out at somebody, I just 1, 2, 3, 4, 5. So I was smiling because I kept that, and I do use it, and it's very helpful.
And there's an app, and I should get paid. I should get paid for this because I use it with my patients. But Calm is
app.
a wonderful app.
Oh, I got to get that.
Calm. Put it on your phone, and if you like the rain, if you like the ocean sound, if you like, crickets or whatever you like, it'll help you relax. And then we can also talk about visual imagery.
Yes, I want to welcome another voice to this conversation. What a great panel we have here. We're being joined right now by the Congresswoman represented from the 37th district. She's reelected for her 5th term, and she is a friend to this radio station and to our community organizer, Congresswoman Karen Bass, the chair of the Congressional Black Caucus. Good morning, Congresswoman Bass.
Good morning. Good morning.
And I should add, Congresswoman Bass is also a former medical professional. So it's like the best of all worlds for this conversation. We got some great news on yesterday, right? Congresswoman Bass, you were able to come up with, Nancy Pelosi, and were able to come up with a compromise on a bill, right?
Absolutely. And I just have to say something that the country definitely needs to recognize. Nancy Pelosi is leading this nation, You know, this is such an extreme example of what happens when you don't have a leader in the White House, because we do not need to have all this chaos and all this confusion. They knew about this virus several months ago, and they chose not to respond in terms of developing the infrastructure for testing. You know that they dismantled the infrastructure that President Obama put in place. And if you just think about it, when Ebola hit a few years ago, far deadlier than this virus that we're dealing with, Obama mobilized the entire world to stamp it out. The World Health Organization predicted 1 million people would die. Because of his leadership, and of course one person dying is too many, but 11,000 versus 1 million, 11,000 people died, and it never really hit our shores. One person, 2 other people were infected. That's what leadership does. We don't even know the state of this virus because people haven't been tested. So the chaos that has ensued in our country is really the result of not having leadership in the White House.
Yeah, it's a great point. I mean, I've been reading about how the president, is trying to stop people from using the Medi-Cal system to address the crisis, about how he's tried to suppress testing because he wanted it to look like there were fewer cases so it wouldn't impact his reelection. I mean, just things that are quite nefarious.
Well, and he's having a press conference right now where all he's talking about is the stock market. And it's really shocking. And if you look, and I'm sure you've seen those charts about testing around the world.
Yeah, I have.
And we have the lowest number of tests of any developed country in the world. Mm-hmm. And it's really just shameful what's happening now. But I do hope people take this as a lesson to see one more extreme example of why we could not go through 4 more years of this nonsense.
Yeah. Well, it's a great point, because when I see things like, okay, he's blocking states from using Medi-Cal, to me that's like, it's almost like you don't care about people, or you almost like you want people to be sick. I mean, to me, no matter whether you're Republican, Democrat, or whatever, you don't want people to die.
Well, I think that, he really has been in complete denial about the significance of this disease. He kept saying, well, it was going to go away. Yeah. Pretty soon there'll be nobody. So he has been in denial. But while he has been in denial, people have been suffering. And since no one wants to work for him anymore, the only people around him are essentially people who will do whatever he says. And all of that has put this country in jeopardy. And these are the kind of things we have to remember as we go through this journey. We don't even know where this is going. We don't know how bad it's been. And so what's happened is that we're fortunate in California. We have the leadership in our city. We have the leadership in our county and the state. But they shouldn't have to do the job of the federal government. They're doing the job in spite of the federal government. So we finally came together only because of Speaker Pelosi. Be very clear. And we did pass significant legislation that people can take advantage of. So the idea now that people should be able, when the test is available, they shouldn't have to pay for it. People should be able to have paid sick leave. They should be able to have paid family and medical leave. But, one of the things that he did around immigration, you remember that thing called the public charge? Yeah. So if you used any public resources, that would be held against you, and you would never be able to be a citizen, and you would be subject to deportation. So one of the things that Speaker Pelosi did was put in the bill that you will not be, it will not be counted against you if you go to the hospital and receive a test because you might be sick. That's the kind of thing, like you talked about, cutting back on medical care. He also threw or is attempting to throw 700,000 people off of food stamps. Yesterday was countered against that.
So, in other words, you guys were able to negotiate. Because let's think about this. If I'm an immigrant and I don't go to the hospital or get tested, but I have COVID-19, but I'm still running around here, I might be even cleaning people's houses, infecting people all over Beverly Hills or wherever. And I don't want to go to the doctor because then I will never get citizenship. That's what you were able to negotiate out of the bill.
Exactly. And that's why the notion that you can be an individual and all that matters is you is why it's so dangerous. That's why his policy of quote-unquote America first, because he doesn't really mean America first. He just means rich people first. He has taken no leadership in the world. This is a pandemic. That means it impacts the entire world. The president needs to do what a real president did, which is President Obama. He mobilized the entire world. That's what needs to happen now. You can't just say America first because we are a global citizenship now. And so, we're one plane flight away from a disease coming into this country. That's exactly what has happened. And so if you have this perspective of America first and I don't care about the rest of the world, that actually hurts Americans.
Yeah.
And
Well,
that's the kind of nonsense that we've had to deal with.
when I heard him say a foreign virus, I was like, oh, viruses have passports now?
And you know what? Exactly. And so what has happened is that it has increased attacks against Asians. I'm sure you have seen that.
It's crazy.
There's also, Asian restaurants have been targeted, Asian businesses have been targeted, and they've been, having extreme financial difficulties because of it being perceived as a quote-unquote Asian virus. Now, if you saw his press conference yesterday, everybody at his press conference was the leader of a corporation. So what is he going to do now? Is he going to give, tax giveaways to CVS and Walmart and Walgreens for them to provide the tests? Instead of having scientists and physicians there, he had corporations. And his press conference today, which he wasn't even supposed to be at, he essentially ambushed the vice president's press conference. He shows up, and all he talks about is the stock market.
It's amazing. Well, at least he's transparent about what matters to him. Congresswoman Karen Bass, I don't know if you can stay with us. We have a lot of people on the phone that want to ask questions. I'm not sure if you have time for that. Dr. Gloria Morrow, she's a psychologist. She's with us in studio. We also have with us Dr. Noel Reed, who's a medical doctor, family physician. And we have from Martin Luther King Hospital, Dr. Maita Kuvengwa, who I hope I'm not saying her name wrong still. Will you say your name?
Maita Kuvengwa.
Kuvengwa.
Yeah,
I actually got it. Yeah, you're so lovely to come in this morning, all of you. And we're taking your phone calls, 520-KJLH, 520-5554. It's about dealing with the coronavirus. It's a special edition of the Front Page. We're live from the KJLH 1-800 The Law 2 studio, Radio Free 102.3 KJLH.
102.3 Radio Free.